who start spreading the disease before they develop symptoms is a much bigger contributor than we had previously thought it would be. And so that's one of the reasons that the White House task force is saying now maybe if everybody wears masks, those infected people who are not showing symptoms are less likely to expel those droplets and infect others. But I want to be clear that we still want to use surgical masks for our healthcare providers because there is a shortage of that. So really this is referring more to sort of homemade cloth masks, which again are not so effective at protecting you, but potentially effective at protecting others. And then the other caveat is to make sure that you wear the mask properly. Don't actually touch your face more because that could increase your infectious risk. So I think that's been the biggest change. And of course, we're hearing today that there may be some changes to these to the guidelines, the coronavirus guidelines from the White House press briefing, which is about to come up in a few minutes here.
Yeah, we seem to keep going live whenever the president's going live. He kind of changed times on us, but we'll get you that latest will come up as well today. Thank you for that update. Again, we're talking about the 9Health Neighbors program today. Our theme this week is how you can help, how you can get help during this coronavirus pandemic time. I'm joined by Dr. John Bouquet and Dr. Robert Perron, and again, Alex Andrews, our Director of Volunteer Engagement at 9Health. So first, Alex, Dr. Coley just gave us our update on the coronavirus. Again, you can ask your questions about the coronavirus, the 9Health Neighbors program, really anything in the comments, and we'll get those answered. But Alex, tell us what the 9Health Neighbors program is.
Sure. In general, 9Health Neighbors is a way to connect community members across Colorado with the typical volunteers that they would see at the fair. So the participants that come to the fairs are typically looking for medical education and medical screenings. We know that we have 50,000 plus people that come to these fairs in the spring, and they're not able to access those 9Health fairs. So we really wanted to work with medical volunteers. Some of our medical volunteers are, some of those folks that are stuck and isolated at home, and they're not actually actively working now. So it was a great way to utilize these medical volunteers that have this medical knowledge. They have medical experience. They know 9Health Fair really well. So it's a great way for us to connect participants that typically come to a 9Health Fair location with the medical volunteers that are there in their community helping them. And we can do it remotely from anywhere that we are. There are some non-medical options as well. So Stephanie, when you're ready, I can get into that stuff. But the medical aspect is really to keep going with that medical education and whatever the doctors, nurses can do over the phone with these folks and still help them out in this time.
Yeah, and I think it's important to note too that we're doing these Facebook Lives all the time, but a lot of people that are maybe isolated don't have access to Facebook, don't have access to the internet. So if you know someone like that, maybe an elderly person that's in their home and needs to talk to someone, they can call our 9Health Neighbors line. The numbers behind me, I don't know if you can see it, we'll put it in the comments. It's 303-698-4455 extension 2005. So that's that number. You can call it right now, and a medical professional will call you back within 24 hours. Alex mentioned non-medical professionals as well, and we'll get into that in just a moment. First, I want to ask each of our medical volunteer doctors, and Dr. Bouquet, I'll start with you. Why did you want to be a part of 9Health Neighbors when you received the call or the email from our team? Why did you want to be a part of it?
So I've been working with 9Health Fair for the last 10 years and volunteering at Skyridge and Parker Adventist. And I had my own practice in Parker for the last 15 years, a family practice. And then I started over at Rocky Vista University, and I'm in academics now, and we're actually kicked off campus. So I wanted to do something to help, and so I'm here to answer any questions.
And Dr. Perron, same question to you. I know you're a 9Health volunteer as well, but why did you want to be involved with the 9Health Neighbors program?
Well, I have been working with the 9Health Fair for several years now. And when our spring fair was canceled because of the virus, there are people that still want some health education. They still have questions, both about the coronavirus and about other health issues. Some of them don't see a doctor regularly. Some of them don't have ready access or not comfortable using the internet. So I thought that having a phone access where people could call in, get connected to doctors to give them health information, answer those questions would be very helpful.
And Dr. Coley, maybe I can ask you, just bring you into this as well, the importance of what we're doing, people having access to health professionals in this way. and how it will kind of help their health journey without us having the spring fairs. Just kind of your thoughts on the 9Health Neighbors program.
I mean, I think it's a fabulous program. And I think that at a time like this, when everything is changing so much, information is power and information is our strongest weapon. And so to have access to medical professionals and other professionals, just with a phone call, I think it's a tremendous contribution to our community. And I think that this pandemic has really raised the awareness of our health in everybody's minds. That's the silver lining. It's made us realize the power of prevention and just how important it is to stop disease before it happens. So I actually think it's made, what the mission of the health fairs is even more paramount. And once the dust settles on all this, I know that we'll want to start thinking about our preventive habits and health. And so I think having this program is just a great way to get people through this difficult time.
And Dr. Coley knows firsthand just how many questions you can receive just about the coronavirus. And I think you guys will probably get a lot of questions that you'll be responding to. Again, I want to ask both of our doctors, you both volunteered at 9Health Fairs, so maybe each of you can tell me the types of questions that you've gotten and what you're kind of the questions you're expecting to get with the 9Health Neighbors program, like the kinds of questions people can call in with. Dr. Bouquet, I'll start with you.
Yeah, just any and all questions. We have tremendous resources through 9Health to be able to place these calls into the proper places that they need to be. So, typically when I would be in the question section of the 9Health Fair, it ranged from diabetes to hypertension to heart disease to rashes. We have a little neighborhood thing, and one of the ladies got a laceration, and so she sent out on our neighborhood next door, does this look like it needs a stitch? And so those are the kinds of things that we're here to kind of answer, and hopefully put the patients in the right direction as far as resources go.
And Dr. Perrin, maybe you can add to that as well, what you're kind of expecting to get questions about and what you've received questions about at health fairs in the past.
Yes, I would add to what Dr. Burkett was saying, that people come with questions they had on their mind that they don't go see a doctor regularly, but they save up for the health fair. For example, they learn that somebody in the family has diabetes. They realize they themselves are getting a little bit older. Maybe they put on some weight and they wonder, are they at risk and what should they do to check it? For example, if they get a blood test for hemoglobin A1C, it will tell them and tell their doctor how their blood sugar has been running over time. And those are typical questions we get from people when they're signing in for the health fair. I expect now we'll get a lot of questions about the coronavirus and specific things like that, although I haven't gotten any calls yet from the 9Health Neighbors system. I've got a lot of questions from friends and family. What do I see on the internet about the coronavirus? How does this affect me? And why do I need to follow these recommendations on isolation? Those kind of questions, certainly the doctors and the medical professionals available through the 9Health can answer those questions. Right now, you shouldn't walk into an emergency room, an urgent care, or your doctor's office just to ask a question, because there may be sick people there. And particularly if you think you have the coronavirus symptoms, you started with a cough, now you have the achy flu kind of symptoms, you want to call there first, find out where is the testing center, what your steps are you need to do to be able to get set up to go do that. Maybe if you don't have an urgent care close to you, you can contact your local public health, or through 9Health, calling your line, they can find out who to contact next and the proper steps if they feel like they might need testing.
Yeah, that's all great information. So again, we're talking about 9Health Neighbors. It's a new program that we've launched through 9Health. It's your way to reach a real life person and ask your questions. We're not having the spring health fairs right now, so it's kind of our way of connecting you to those medical professionals you might ask your health questions to. And like Dr. Perrin said, it could be about the coronavirus, could be about heart disease, diabetes, other prevention measures that we'll maybe be focusing on. Once all this is, like Dr. Coley said, the dust has settled a little bit on the coronavirus and we get kind of through this. Someone did ask Dr. Coley in the comments when we think that this will all peak. I don't know if there's even a good answer to that yet, but maybe you can offer some insight.
So New York State is the farthest ahead on the timeline, and their peak is anticipated in about 2 weeks or so. So the rest of the country is probably going to be farther back on the timeline because our cases are not growing as fast. And so the earliest potential peak would be a couple weeks after that. So we're looking at about a 3 or 4 week timeline. Now, the one caveat is if we're doing social distancing, which we are, and it's working, we actually flatten the curve, but we actually prolong the time of the peak. And remember, that's the goal. We really want to buy ourselves some time, really delay that peak as much as we can so that we can be ready for it. We can work on vaccines and work on treatments and really have our hospital systems ready. And people aren't getting sick all at once, but later. So in an ideal world, our peak would actually be even farther than that, something like 6 or 8 weeks. But more realistically, based on how things are going right now, we're anticipating about 2 weeks for New York and probably a couple of weeks after that if things continue along the same trajectory.
Right, delay the peak, but make it a lower peak, not as high.
Exactly.
Again, talking about the 9Health Neighbors program, Alex Andrews, our Director of Volunteer Engagement, I want to give her another question and just kind of reiterate what this program is all about. Why have we started this 9Health Neighbors program? And you can kind of talk now too about, there's medical volunteers to answer questions, but there's also a chance to connect with a non-medical volunteer and what that's about.
Sure. So the 9Health Neighbors program was started by a big group of us staff, and we reached out to the medical volunteers to start the 9Health Medical Neighbors first, and we do have those non-medical aspects as well. But we had an outpouring of medical volunteers that wanted to help. We could tell that there's so many people from home, whether it's, as we've all put it today, that they would like to talk to somebody on the phone rather than listening to a video or, logging into a Zoom conference, that kind of thing. So this way you get that one-on-one personal connection. It's more private. You're not listening to a whole group of folks. We're still utilizing people that have a lot of medical expertise to answer these participants' questions. 9Health Fair has been around for 40 years. So, as our doctors on this today have put it, that people come to the health fairs to find reliable people from their community that they trust and they're comfortable with. We continue to be partners with many medical centers out there. So we are not trying to replace doctors at all. So still go to your primary care doctors. But if you need a phone call from a medical volunteer just to connect and say, hey, should I follow up on this? Or should I be concerned about it? They can give you some medical education on the spot. And for the non-medical volunteers, we do have something called 9Health Good News Neighbors. So we know during this time, a lot of people are really focused on, kind of the scare. We're all experiencing some hesitation, some anxiety. What's the right thing to do? But there are so many good things happening out there in our communities. And those good news neighbors can really help us highlight what's going on out there. So if you've got, a video or a picture and a little story of something that your neighbors did to help out, whether it's grocery shopping, connecting someone to a program like this. It may not be 9Health Neighbors. Maybe it's another assistance program. But what are your community members doing out there to support each other? Let's tell those stories. It's just uplifting. It feels good. And we want people to remember there's lots of good stuff happening right now.
Yeah, I think we're getting to that point too, where we all want to be informed about the coronavirus and COVID-19, but we want to have some hope, some good news stories as we're all, distancing from each other, maybe trapped at home, what we're all doing. I'm just checking our Facebook comments, seeing what else we're kind of getting right now. Dr. Bouquet, I want to ask you, just talk a little bit about this program in relation to the benefit of, connecting with someone right now and talking to someone on the phone, the benefit to someone that's maybe in isolation, getting to actually speak to someone on the phone.
I think the spoken word is very, very powerful. And like Dr. Perron said, it's difficult for elderly patients to grasp the technology that we have and communicate that way. Actually getting on the phone and speaking to a patient is not only satisfying for us as physicians, but also for the patient in general. It is a connection that is second best to just being there.
Well, and Dr. Coley, on 9 News yesterday, you were talking even about how medicine has changed. And I think this is it kind of connects, it brings it back a little bit, because you were talking about how doctors, the physical touch is healing, something you can't do with a coronavirus patient. You know, talking, being face-to-face more and communicating with a patient. I feel like this is, obviously this isn't, you know, hopefully not coronavirus patients that are in critical need or anything that we're talking to on the phone, but this connection of community and being able to reach out to someone and talk to them on the phone, just the benefits of that to maybe both the medical professional and the person in the community.
I mean, yeah, that is the fundamental crux of the patient-doctor relationship. It's looking somebody in the eye, holding their hand, and talking to them. And unfortunately, because of this virus's infectious nature, we don't have the privilege of touching them or holding their hand or looking them in the eye. But the next best thing, I think, is hearing their voice and connecting with them. So, you know, it's not just something online or text message or and to get personalized attention. I think at a time like this it's critical because, you know, we know the healthcare systems are overwhelmed. A lot of primary care doctors are getting calls flooded. And so this is a great way to get information from a medical professional one-on-one.
And Dr. Perrin, we got a question about the coronavirus in the comments. I'll kind of let you answer this one. Dr. Coley's been answering a few of them, but we'll pretend this is someone calling the 9Health neighbors line too. We'll just get a little rounded. Someone said, if I'm healthy with no underlying conditions already, does that help me against the coronavirus?
It does, and particularly if you should become exposed, you have much less risk to have a serious case of it. Those are all good things. That does not allow you to go freely out in the neighborhood where even though you have no symptoms, it's possible you've been exposed and you won't have symptoms for a week. Similarly, you don't want to be exposed to someone, the converse of that, they don't know they have it, they're out in the community, and now you have become exposed. Then you are a carrier and you risk exposing anyone else you see, whether it's visiting, you know, an elderly parent, or you have someone else at home that is immune compromised and not as lucky as you to not have other problems.
Yeah, and I think that's still good advice. We're all protecting those that are more at risk by physically distancing ourselves from each other. I want to go back to the 9Health Neighbors program. Alex, talk about the need, I guess. Is there any need right now for volunteers for this program? Any other ways people can help with 9Health Fair right now that we don't have the spring fairs? Are there other ways they can help?
Yeah, good question. So as far as medical volunteers, as I said earlier, we did have an outpouring of medical volunteers that were excited to put their time and their expertise into this new program. We are looking for more non-medical volunteers though. So if you can, you know, reach out to me, it's alex.andrews@9healthfair.org. We can talk about different projects. It may be the Good News Neighbors that I already mentioned, and you're just reporting out. And we would have a specific way that you could report those stories out. So that's not necessarily me, but we might have other projects. There are some, now and then there's projects kind of behind the scenes, helping us keep things organized. So for non-medical volunteers, we definitely would love to hear from you. For medical volunteers, we have a large kind of call log of folks that are not working at all. So maybe retired medical volunteers, and they are at home and need to stay at home for all the reasons that the rest of us do. And then we also have an active list of still working medical volunteers that they're like, I have some time. So if you get a heavy call volume, I'm here for you. So we definitely are okay on medical volunteers, and you know, we'd like to keep the list the way it is. I don't want to get more people on there and then not have anything to do. But we can have that wait list for now. So yes.
So, and when someone calls, it'll go down the list of medical volunteers as they've responded to you.
Yes.
For the need.
I let folks know that if they're still working, and they told us that they were actively working still, that they were on kind of the backup list, just because those folks, you guys, we want you to stay healthy and your energy towards, you know, seeing the folks, the patients that you are in the community right now. So the folks that are at home still and are not actively working, we'll utilize them first. If the call volume goes up, which we hope it does, we would definitely want to be here for community members across the state. So that's how we're doing it. We're starting with the folks that are stuck at home and going stir crazy. They want something to do. They want to help people. So those are the people we're going to focus on first.
Yeah, I think a lot of us are wanting to help in any way that we possibly can. And that's kind of what we're focusing on all this week. Tomorrow, we'll have a 9Health virtual town hall again, where we'll have several members representatives from the state, really. Food Bank of the Rockies will join us. Vitalent Blood Donations will join us. Again, we'll have the Colorado Department of Human Services joining us. Dr. Pyle Coley will be on there, and we'll talk about different ways that you can help in your community, and maybe the way that things have changed too, as far as donating food and donating blood, and what the need is right now. So we'll address all that tomorrow during our 9Health virtual town hall. That's from 4 to 5 tomorrow. But before I let all of you go, since Alex mentioned the good news neighbors, I know you're medical people, but maybe we can all share a good news story we've heard. Does anyone want to raise their hand and go first? Anyone have a good news story to share? I'm putting you on the spot, and I did not prepare you.
I have a short one. We actually have had people put up posters down. We have a central mail area in our subdivision, and a couple of the young people in our neighborhood have volunteered to make runs to the grocery store for older folks who either can't get out easily or don't want to be in a large group, just even for simply going to the grocery store. So I think that's how our neighborhood is coming together, and people helping people.
Yeah, I think that's great. When I was on a walk today with my family, we were saying, just all the chalk art is fun. Like you all, is one that said you were strong, one that just said stay home, but still fun messages on the sidewalk are kind of nice, and people putting hearts and teddy bears in their windows, trying to spread some positivity. Anyone else have a positive story they want to share before I let you go?
I think that lady with the that needed stitches somehow got her stitches. Everything is looking good.
Good.
Yeah, there was a video that I saw where, and this I actually shared with my in-laws, but someone made a video about how to order groceries online because my mother-in-law was very resistant to this. So I had another neighbor that did that. And how do I, sign up for ClickList or one of the other, order groceries through Walmart or wherever it might be. So they were did step-by-step tutorials that they could send to people. If you've never done this before and you're trying to stay home as much as possible, here's how you do it. So just little ways to make people more comfortable.
Yeah, I think that's great. Dr. Coley, any positive stories?
I was thinking about 9 News actually played photographs of Denver at night without anyone in it. And I thought that, we've been looking at this so negatively as isolation and distancing, but if you think of the peace and the calm, and the photographs were just so reminiscent of something just so wonderful. So I think we can just look at the glass half empty or half full when it comes to anything, and all of these stories kind of embody that times like this bring out the best in people, and it's all about perspective.
Yeah, and we are isolating to help our neighbors and to help our community and help each other. So that is the positive in all of that as well. All right, I'm going to let all of you go. Again, this was about our 9Health Neighbors program. It is a line that you can call and reach a medical professional and get your questions answered. The number we posted in the comments, it's behind me if you can see it, but it's 303-698-4455, extension 2005. So give our 9Health Neighbors line a call, a medical professional, a 9Health neighbor. We'll give you a call back. You can chat with them, ask your questions, just like if you were to visit a spring 9Health fair, and just get whatever advice that you were hoping to get, or just chat with someone as well. I'm sure we can all use that too. I will let all of you go. Thank you so much for joining us, and we will sign off for now.
Okay, bye.
Bye.
All right, live stream is stopped. Dr. John's already gone. Good job.
Thank
All right,
you,
thank you.
Stephanie.
I had a quick question. Is it what are the hours on the 9Health Neighbor program?
People can call anytime. The one restriction that we have that we let them know is that it's going to take 24 hours for a medical volunteer to get back to them. We think it's going to be shorter than that, but just to give ourselves, some safe space.
So they would just leave a message